Hi, my name is Brooke Cox. I'm founder of the NAPNUG. I wanted to talk to you guys about something today that's pretty important and close to home for me. And it's about patient care between chronically ill patients, whether that be narcolepsy like I have, autonomic dysfunction like I have, depression, anxiety. We could go on and name, fibromyalgia, multiple sclerosis, any of these invisible illnesses that people often say, well, you don't look sick. In our community, I often hear people say, I'm jealous of cancer patients. I know what they mean, and it's not in any type of offensive way. Personally, I have a father who's battling a really hard battle with cancer right now, and I don't want to trade places with him. And I'm not belittling cancer. I think it's serious. Obviously, I think everyone knows cancer is serious. But the difference here is someone with a chronic illness isn't in immediate danger of dying. They are sentenced to, and I hate to use this word, and I've been told not to a couple of times, but they're kind of sentenced to suffer the rest of their life. It's a chronic, incurable disease. It's not going to kill you, but it's not going to go away either. You live with it every day. So when people in this community of chronic illness say, I wish I had cancer, what they're really saying is, I wish there were hope for me to be better. Most people that are diagnosed with chronic invisible illnesses don't have hope that they'll get better. They are sentenced to a lifetime of being sick every day. And I bet everyone's aware, or most aware, or if you're not, I'm going to make you aware, that there's some issues going on with our healthcare system where doctors are overbooked and understaffed, and it's hard to get appointments places. Just to get in with my primary, it's a couple months out. With a specialist, 6 months out a lot of times. And personally, I applied for a program that I needed to go to that was about a year and a half out. My life is not in immediate danger. So I get to wait. And the doctors are booked solid. And they have choices to make. And I agree with the choices that they make. They can take the cancer patient who has to have treatment. And they have to have treatment now. Or yesterday. Or they may not make it. Or someone like me who will be around when and if they have time to help so that maybe we don't have to suffer as much every day. What I think a lot of times doctors don't realize is our lives could be at immediate danger. Depression and mental illness often accompanies chronic diseases. Of course it does. You're sentenced the rest of your life to be sick. And we all know right now that suicide is very serious and it does take lives. How do we fix this? And I thought of something, and it's pretty simple. There's never been one time I've sat, well, there has been like one time or a couple, but not with a doctor that was my doctor. So if we put them in the categories of the buckets that are my normal doctors, there's never really been a time I've sat in their office and felt like they didn't think that my issues were serious. Could I get an appointment really quick? Often not. Do they follow up with me all the time? Often not. Because they have people dying tomorrow or that need their immediate help. But I realize I've taken loved ones to the doctors with me often. And there's this implied moment with me and the doctor. It's like a nod or a body gesture. It's not verbal communication, but it's, and I'm sorry, or we get it, we understand. The doctor knows that the illnesses that I have are serious, and I understand that they have patients that need them now. But it occurred to me, this is never spoken out loud in front of our loved ones. And it should be. And it could change so much, and it could save lives. What if in that moment where we're being silent and we have like this implied communication because we see our doctors all the time, the doctors were to look at our loved ones? And if they're not there, make an appointment and ask the loved ones to come in and explain to them that this person that lives with you, your loved one, is sick. And they are just as sick as the other patients that I'm having to help immediately. The only difference is your loved one isn't dying tomorrow, and this one might if I don't help them. But I feel like what the loved ones hear when the doctors put you off a little bit for those other patients is, it's not that serious. You can't get in to see them that quickly because you must not be that sick. But that's not that at all. It's, and I hate to say it that way, we have incurable diseases. We're not very helpable. And the doctors are going to help the ones that are the most helpable. I agree with that. I realize that doctors might be able to save lives by simply telling the loved one they're just as sick. Give them some empathy. Explain to them how serious it is. Explain to them that they may need a casserole sometimes. And maybe this empathy that people with chronic illnesses have could save lives by making that person feel helped, not looked down on as lazy, and just everyone have a better understanding for what's actually going on. And that's it.